and today we have even more. And it's time, I think, to look at some results in patients. These CT scans are from a patient treated with anti-PD-1, but they illustrate processes seen also with anti-CTLA-4 treatment. You can see the tumor marked by the red arrow in the lung. Note how it has shrunk dramatically to your right, and it's on its way to disappear at 4 months after initiation of the treatment. But please note also what happened shortly after the treatment had started, at 2 months in the middle. The tumor appears to be significantly larger than it was from the beginning, but this is not real growth of the cancer. It is due to swelling caused by the inflammatory response, with many immune cells entering the tumor. And this is called pseudoprogression and is observed quite frequently, and it caused confusion initially, since other types of cancer treatment usually results in an immediate response and shrinkage of the tumor. Let us finally look at an example of compiled results from many patients. These curves represent survival of treated patients with a certain type of melanoma. And you should note that just a decade ago, most patients with advanced disease like this would have died already after 2 years. Previous standard therapies resulted in long-term survival for few, 10% or less, and it would have looked like this. The curve compares 3 groups of patients treated with checkpoint inhibition. The release of one brake, CTLA-4 in green, release of the other brake, PD-1 in blue, and release of both in yellow. And we can appreciate that both treatments are working, anti-PD-1 in a higher proportion of patients than anti-CTLA-4, but please note the combination, where more than 60% of the patients are still alive after 3 years. This is a spectacular advance in the treatment of a solid metastatic tumor, and we can expect even better results in the future when these different checkpoint inhibitors will be combined with conventional treatments. So, in summary, Allison's and Honjo's discoveries have added a new pillar in cancer therapy. It represents a completely new principle because, unlike the previous strategies, it is not based on targeting the cancer cells, but rather the brakes, the checkpoints of the host immune system. The seminal discoveries by the 2 laureates constitute a paradigmatic shift and a landmark in the fight against cancer.